everybody. So just to introduce myself, I am Fran Beadle. I am the chair of the BCS, the British Computer Society Nursing Special Interest Group. And this today, the aim of today is to tell you what we've done over the last year and what we are planning to do over the next year. So as you will all be aware, for those who have received the communication, the chair's report came out and really wanted to highlight some of our successes from the year. So the committee is made up of 6 different nursing informatics leads at varying different levels of their careers. We've got an early learner up to a chief nursing information officer, research and innovation, and also the incoming chair of IMIA, the International Informatics Association, Nick Hardiker from the Nursing Informatics branch. So looking at our achievements for the last year, so there have been, I would say, a significant amount of success this year as nursing become more involved in the nursing informatics agenda and the medical informatics agenda. So one of the key things that we've done, we've developed a memorandum of understanding between the British Computer Society, the Royal College of Nursing, Professional Records Standards Body, which is our UK National Data Standards Association, and also the 5 countries Digital Nursing and Midwifery Leadership Group, which involves the CNIOs from each of the countries. The aim of that memorandum is to ensure we work collaboratively, because what our users have been telling us that they would like a single point of access to information, but also the development of programs moving forward. So we plan to move forward with that. Alongside that, there are key pieces of work ongoing, which I will discuss in future reference groups. BCS are also active in the IMIA NI. They are the professional body for the United Kingdom, and this supports the nursing informatics leadership and includes advisory panels. And our UK lead is Nick Hardiker, with Professor Dawn Dowding, vice chair for advisory panels. And we send out the monthly newsletter that comes from that arm of the organisation. We also, as you'll all be aware, potentially were successful in the bid to host NI 2024. So actually that has culminated in where we are today. And I would like to say thank you to Dawn Dowden, who has been fantastic in this, and actually the programme today that we've had so far has been hugely successful and really opened up some conversations, not only within the UK, but also internationally. So well done. Big shout out to Dawn. And then the other piece of work that we've really looked at in the United Kingdom, the UK Faculty of Clinical Informatics has ceased to exist now. So as part of the work moving forward is bringing in the Faculty of Clinical Informatics, all the hard work that they've done to date, such as the clinical informatics competencies and how we can work together. And I can actually pleased to announce we now have the British Computer Society Faculty of Health and Care, which is a newly formed one that will be a conference in October, the first inaugural conference. So I encourage everybody, when they see anything in relation to that, that they sign up to that. In addition to that, Dawn Dowden was invited to speak at the European Conference of Medical FME, European Foundation of Medical Informatics conference, to represent the nursing profession, i.e. BC Nursing Informatics, and the details are within the report. Ongoing activity, so the group has planned, and I'll talk a bit more about this in future steps, ongoing collaboration between our United Kingdom special interest groups and professional bodies to ensure that we're aligned in our strategic priorities and how to move the profession forward across the United Kingdom and Ireland. Hosting the annual general meeting, which is what we're doing now here today. But also part of that work is we've put a bid into BCS to develop a potential educational webinar series with our professional colleagues within BCS. So one of the key things about joining BCS, and I will be quite openly say to people when they ask me to be chair of this programme, I say, what has the British Computer Society got to do with nursing? But actually it's about being at the table to make sure that whatever education, competencies and resources we have are fit for purpose for our nursing community, which is especially prevalent now that since the faculty has come over to us. So we're looking to develop a potential educational webinar series, which is a lot of the technical information such as project management, coding languages, to almost develop a micro credentials to support people in their career pathway journeys. And in addition to that, because the faculty has come into the BCS, British Computer Society Faculty of Health and Care, one of the key things we want to make sure is whatever we develop is what our members want. So we've put forward a bid to host a facilitated workshop to understand what members would like, and that would be bringing in people from the historic faculty to make sure that nursing are well represented. And I would put a call out now that, you know, we would really like new members, so please feel free to apply to be new members and to make a difference across the United Kingdom, but also informing policy and UK policy alongside that. So part of that programme of work, obviously, we are a limited resource, and part of that, this is a voluntary organisation, so all of us do this role in our spare time as not part of our day job. So, you know, it is a commitment to do this, but because there's limited capacity, that also affects how quickly we potentially deliver stuff, which is one of the reasons why we wanted to join forces with the various other communities that I have mentioned. And also there is limited leadership to be able to effectively communicate with the inability to communicate effectively with our nursing membership. One of the core things that we've all identified is that the BCS website is not that user-friendly, and access to information is difficult at times. So that's one of the key things that we will be putting forward. And that is, oh no, there's a little bit more. Work continues, obviously working with policy and practice to make sure that the key requirements for nursing are strengthened, and look at, you know, one of the key things that pieces of work recently, there's a lot at the moment around AI. So we have helped support develop any policy statements that go forward to the UK government. So we are fully supportive of that in our role. We're also, again, going to be speaking, not maybe speaking, but we'll be attending the IMEA conference and also the FME conference. And I would be encouraging us to submit abstracts to say where the UK have been and where they're going through over the last year. And obviously we're an active member within the IMEA process.
I just wanted to say for those who don't know, Next Informatics Europe, which is the European branch of IMEA NI, their next conference is in Glasgow next May, and it would be so in terms of ability for us to get there, it's much easier than the European conference. And I think if you Google it, they're open for submissions at the moment. I think it closes around September, October time. So I guess there's a plea from those of us in the UK to inundate them with submissions like we did for this conference, so that we can maximise the European presence as well.
Thanks, Dawn. So that is the yearly report for you all you've all had an opportunity to read it. And now I will hand over to Annette Gilmore, who is the treasurer of the BCS Nursing. And actually, we were being actively encouraged to participate with our finance colleagues for nursing to be supportive of that programme of work moving forward.
Hi, everybody. This will be a very short report. I have done a treasurer's report, but just to explain about the BCS, their financial year starts from the 1st of September and ends on the 31st of August every year. So for this year, I can give you what income and expenditure we have. For next year, I have done the report with just the activities, because we won't know. They will allocate funding in July, which they should have done by this month, and next month the groups will be informed of what funding they've been allocated for the year in the budget. There's also another aspect to getting funding with BCS, is that you can put in a special funding request throughout the year. So if there are certain things that come up that we haven't planned for, we can apply for funding. I think it's on about a monthly basis. We fill in a form and we put in for funding, and we're often successful with that. It's often a better way of getting actually allocated funding for specific activities. And for this year's budgets, that's what we did. For this year, we didn't put anything into the general budget, but we got two special funding requests, and we were allocated £5,105. The BCS don't have a lot of money to give to groups, but they're quite good at giving things when we ask for specific requests. We have spent most of it. The special funding requests were for this conference. Two of them were for this conference. So NI 2024, we have the sponsorship package, which meant that we have the stand here at the conference. That costs like £3,126, and that was all spent on that package. We also were allocated £1,647 to help with conference fees for attendees to attend the conference. So we actually were quite well. We actually got 3 people to attend on that sum of money. Sian, who came as a student. We have Nick, who got reduced fees because he's part of the committee, and I was able to come because I'm helping out at the stand. So we were able to, fund our places and also pay for accommodation and some expenses. So I think if we want to do any of these things, don't be afraid to come and ask. We can put in the money. We won't, if we're realistic about our expenses and what we're asking for, they're quite good at accommodating us. And then there's the Derek Hoy lecture. It's an annual lecture which is held in Edinburgh every year, and it's a memorial lecture for somebody who is very a nurse informatician, who was very active in the BCS. And there's an annual lecture every year, as I say, in Edinburgh, and BCS usually fund that. I think we looked for over £300 for that, and we were allocated the money to send somebody. Again, Nick went to that for us, but again, it's open to whoever wants to go, and we would encourage people to apply for it. So that's for that year. So for this year, which will start in September, our financial year until next August, we have put in a request for some funding. I haven't put anything in my report. It's a 2-page report. Anybody can have it. I've sent it around to the committee members because we don't know how much we're allocated yet. But it's all the things that Fran has spoke about. So basically, to help the transition of FCI members into the nursing committee. So we have, I put in funds, we put in funding requests for the, to help conduct a project to see what members want, to see what our BCS members want and what FCI members want from the strategy, the next 5-year strategy for the nursing committee. and to develop terms of reference. So we will do a report which will then culminate into some actions for a roundtable event, which I think we were thinking about February next year for that. So we'll put in some funding to conduct, to have a venue for, well, the venue should be hopefully free, but to support the running of that roundtable event. Those were those two activities. Then the next activity that Fran mentioned was to encourage some younger people to join the BCS and get new members. So we're hoping to do a series of CPD events, 3 webinars next year. So we put in for some funding to support those. They will be hosted by BCS and a lot of it will be free, but there might be some expenses. And we were hoping to have certificates. If people do the 3 CPD events, then they would get a Fed IP certification free. So that would encourage them, and free, I think we said free membership of BCS for the first year, and hopefully then people would stay on after that. So we put in some funding to support that. Conference attendance, as Dawn was saying, we put in for some funding to support 2 members to go to MIE next year. Usually we do for 1 to have a representative from BCS. So we've put in for 2 this year. We'll see what happens. And also then for the Derek Hoy Memorial Lecture, we put in for funding for somebody to go for 2025. If we're not successful for any of those and we have good, we can always, as I say, put in for the special funding requests throughout the year. And again, it will depend on the outcomes of our roundtable and, what our strategy is and, the activities we want to do that we can help our case to get funding from BCS for anything we want. So I think that's all for me. But as I say, these documents, which are very small, are available if you want them. But it's probably better to wait until we know what we're allocated for the year, in August. Thank you.
Thanks, Annette. Just to explain, BCS is set up of lots of special interest communities. So from the health and care faculty, we also have recognition from primary care, secondary care, clinical data scientists, allied health professionals, mental health professionals, and we all come together for the health and care executive meeting. The chairs come every month and really try to align and ensure that the work we're doing is very inclusive and supports everybody, because BCS's ethos is that, it's about making IT good for people. It's about making it good for everybody, for the citizens across Wales. And of course, that includes across Wales, across the United Kingdom. So that includes us as well. So thinking about next steps, so like I've mentioned, there will be the roundtable, there will be potentially the development of a CPD program, but alongside that, FedIP, which is the Federation of Informatics Professional, which gives you certification to be a certified informatics professional. We are part of that group, and as there are obviously different levels to that, so I would encourage people to go forward with that. But part of what the Federation has been able to do, we're now looking at role profiles across clinical informatics as part of the new digital data and technology plus framework. So that will be going out for consultation around the competence levels within that and what we believe that people need to have as part of their roles, but also a guideline for people to be able to set their own career journeys as well. So we're starting with the first one, which is the senior clinical informatician. And part of the conversation will be, and it's set at the level, it's people working in clinical informatics as a role. And that could be including part-time to a full-time, because obviously different professions do it at different levels of the day, but it's about professionalising the clinical informatics role across the whole of the UK. And that will, like I mentioned, will go out for consultation. And that is me. Is there any questions I can help clarify anybody with? And I would, like I say, encourage people to be part of the journey. I think it's a very exciting time. And I would say, you know, I never thought I would ever be the chair of something called the British Computer Society group. But actually, I have to say they've got lots of resources available to us. And actually now with the faculty coming in, it's really been able, they're a very well-established group that have been supported by a Royal Charter as well. Any questions? Any questions on that?
Do you know how many members of the FCI have transferred across?
To date, I think it's about 74. And there's ongoing communication. And as part of transferring as well from the faculty, there was free fellow membership as well. So they aligned with whatever grade they were within the faculty.
Is that 74 nurses or 74?
No, 74 individuals. Yeah. Some have come over and some have gone into a breakaway group. But I think we're in the very early days, and I think we have a real opportunity to set what we want it to be set up.
I just wonder whether it's going to be worth. Do you still have a list of the FCI members? Some
Yes.
of the columns wasn't. Some of it came through, some of it
Yeah.
didn't come through at the time. So.
Yeah, so some of that has been, you know, obviously, if there are any concerns that have come from groups, please just, you know, feel free, just email me and I'll direct it to the first person. You know, I've had comms that some people got it, some didn't. So actually we were able to facilitate a conversation with people. Yeah. Oh, do you want? Helen? Yeah. Yeah, and I would say that is probably something that we absolutely need to do to put out to our special interest, to our special interest group and the members to encourage them to engage in it. So yeah, take that on board. Thanks. I think it'll be really good to articulate what we're planning on doing. Yeah. Any other questions?
There probably is something to come back more. So so I was originally BCS, then I went back, then I was FCI, then I went back. And the communications from FCI to transfer into BCS, as you said, were anything but simple. And once you got in to BCS, I'm not sure there's a follow-up communication about special interest groups.
Yeah.
So I think there might be some of those 74 of
Yeah.
how many of those are actually nurses are sitting now as a member of BCS, but actually don't know that
Yeah.
there's a nursing special interest group
Yeah.
that exists. So that's.
And maybe what we need to do is work with the healthcare executive to actually identify there needs to be communication that goes out to say what special interest groups there are and actually the connectivity between the groups.
And how you join them as well. I think that's slightly opaque.
Yeah,
Yeah, that's.
It
pretty
is.
exciting.
yeah. Because generally it's a call out via the committee, but I think we're in a very different place now. And obviously that went out as an expression of interest by the AGM. But I think, like you say, it's quite difficult to understand who is part of the special interest group at the moment, because we do have our own separate web page, but actually it's people who log on to those pages. Currently could be anybody, doesn't have to be a health professional, but I think we can set that. So absolutely welcome that and take on board what you said, and I will feed that back to BCS centrally.
Some information on the stand down below.
Yeah.
The processes of BCS, so, and we have the QR code as well. So it's very.
And the lead for the faculty who's leading the transition of the faculty is coming on the stand tomorrow. So I will feed back to her around what, you know, obviously you guys are saying, because it's important how we do it, because it's quite difficult I can email all the member groups, but it's sometimes I'm not sure if you haven't signed up to that member group or shown an interest into it. So I think we need to clearly articulate that to our new members. Even just for other people as well, not just the healthcare professionals. Okay, any other questions? Any concerns? No? Okay, well, thank you. Look forward to welcoming you. Like I said, BCS is down to this. Thank you to everybody online.